Commissioner Lorelei Salas. She's with the Department of Consumer and Worker Protection. And they, as many of you know, about 3 years ago, New York City implemented the new paid sick leave law, and there have been some recent amendments to that law. So today we're providing you with some additional information so that our employers in the chamber can get some of the questions that they may need answered. So I really like to thank the Commissioner for joining us today and her team, and hopefully we can answer some of your questions. So without further ado, I'd like to introduce you to Commissioner Salas.
Hi, Linda. Thank you so much to you and to the Staten Island Chamber of Commerce for working with us on this event. It is so very critical that we as an agency are able to communicate directly with businesses that now have to update some of their practices as a result of recent changes in the law. So very glad to be here today. I am accompanied by my staff from the office, Alberto Roldan, who works in our outreach team, and he'll be helping me add certain links and contact information for everyone to be able to then go back and find those tools, those flyers, and to know how to reach out to us. And I also have with us Liz Wagoner, who's the Director of Enforcement, basically the division of the Office of Labor Policy and Standards, which is the office charged with the mission of enforcing the paid safe and sick leave laws. As you know, my agency has a broad mission. In addition to the enforcing the labor laws in New York City, we also enforce consumer protection laws. We license over 65,000 businesses across the city, and have an Office of Financial Empowerment dedicated to improving the financial health of New Yorkers. Today, we're going to focus though on paid safe and sick leave, which, as you said, has gone through different changes and updates over the last basically 6 years. But most recently, as of September 30th, we have some new updates. And I just want to mention that paid safe and sick leave, it really is a life-saving benefit, especially now post-COVID. We know how important it is for workers to stay home if they're sick, and for employers to ensure that anyone who comes to work in person is free of the virus before they come into your businesses. And as of March this year, both the state and the federal governments acted on this situation, and they passed their own laws that provide paid sick leave benefits. So a lot of information, a lot for employers to digest, and so I appreciate this opportunity. I know that there will be more questions following this panel, so please do come to us if you have any concerns if any of the information needs clarification. So I'm going to first just give a brief overview of the biggest changes in the law, and then we can go into more detail with some of the questions that I know, Linda, your team has already been keeping track of. And so as of September 30th this year, New York City law now is much more aligned with the New York State law, which, as I mentioned earlier, is a result of COVID-19, when the state government decided to pass two paid sick leave packages. One was the emergency paid sick leave that is available for COVID-19 situations, and one is the permanent paid sick leave. Now, we needed to update our law to be aligned with the state law. And so what happens now, since September 30th, there is no longer a wait period for employees to be able to take advantage of this leave. So what does that mean? In the past, employees had to wait 120 days after starting employment before they could access any of their leave. Now that period doesn't exist, and employees could start taking sick leave right after they're hired, provided that they accrued the leave, right? The accrual rates have not changed. Employees still accrue leave at the rate of 1 hour for every 30 hours of work, right? So again, their employees are eligible whether they're part-time, full-time, temporary employees. Obviously, part-time employees are going to be accruing leave at a slower rate, while full-time or employees who work more than 40 hours a week will accrue the leave faster. There is also no longer a requirement that someone be employed with an employer for at least 80 hours before they can have access to this leave. So again, for most employers in New York City, as of September 30th, employees that work for you have a right to take sick leave. Now, there are some changes also with respect to when employees have to get paid, right? Before September 30th, the law in New York City was that employers with 5 or more employees were required to pay, right, compensate workers for the leave for at least 40 hours in a year. Now, with the state changes, the city law also has changed, and it now says that employers that are smaller, so 4 employees or less, if they earn over $1 million in profit in a year, they also have to compensate their employees for that leave. Additionally, the bigger employers who have 100 employees or more, as of January 1st, 2021, have to give 56 hours at a minimum of paid sick leave to their employees. A lot of the bigger employers are already providing that or more, but that is a change that takes effect January. A couple of other things is that as of the recent changes, employers also are now required to inform employees of how many hours they've been accruing. So every time you get paid as an employee, you must receive from your employer, either on your pay stub or on a separate piece of paper, the balance of hours you have either both accrued for to be able to take for sick leave and also the hours you've already taken. I will say also that another big change in the law that may not apply to a lot of the businesses that are attending today or watching this, but in their own personal lives, it may be applicable. If you employ a domestic worker, domestic workers now are treated in the same way as all other workers from other industries under the law, with the exception that a domestic worker doesn't have to work for an employer that has 5 employees. If you're the only domestic worker employed with a family, you have a right to this leave too. And you have a right to 5 sick days in a year at a minimum. Let me see, I think that those are the biggest changes, and I just want to ask Liz Wagner, my colleague, if she feels there's anything else to add at this point, or if we should just go into the questions.
I think that's a good overview of the big changes, and yeah, the questions make sense.
Okay, great. So Linda, I'll give it back to you. I know that you already have some questions that have been coming in.
Yes, I get one of the questions I have is, I know you alluded to it a little bit about why the paid sick leave, the paid sick and safe and sick was amended. And I know that you said it's because you wanted to kind of be in alignment with the state, but maybe you could give a little bit more specificity about why that was needed. And really, I think, the employers understanding what the biggest difference is. I mean, you went through some of those things, but kind of what prompted the city to do so.
Yes, so certainly, when the state law became effective, that law actually applies to all employers in New York State, right? So whether our law had changed or not, you would still be subject to the New York State law. Now, we needed to align our law so that there would be no confusion. Employers wouldn't think that they could choose between the city law and the state law. Now we are in alignment with the state law, but we also have made some clarifications in the language of the law in New York City. Like I mentioned, one of the clarifications is that domestic workers qualify as any other employee and have the right to the same amount of leave as other workers. Let me give you a couple more things. I may have said some of this already, but I'll repeat it because it's really important, obviously, that this information gets to the members of the chamber. So employers, some of these changes are, again, employers with 100 or more employees can accrue 7 days of leave a year, and that takes effect January 2021. Now, again, another change is that the smallest businesses, right, the ones that have 4 workers or less, in the past in New York City, they were not required to pay their workers if they took sick leave. They had to give them the days, but they did not have to be paid.
Right.
That's still the case unless the business earns $1 million in profit or more. In that case, the state decided that these employers have an obligation to pay the workers, and we also changed our law to align to that. There's no longer the requirement for workers to wait 120 days before they can take the leave. Again, as long as you've accrued the leave, you can take it. There are a couple of clarifications in terms of confidentiality. My agency is required to maintain confidentiality of complainants. The law makes it very clear, so that's in the law. Let me see if there's anything else. The other, I think, big requirement is that employers now must inform their employees of the accrual times, the accrual periods, every time that they get paid. So that was a big change, and something that takes operational, changes. So even though the law became effective September 30th, for this particular requirement, for employers who are working in good faith to make those changes, in some cases it's a big task. So we gave them up to November 30th, and I believe that my agency has been very flexible with that requirement. Liz, I'm not sure if there's anything else to add there, but I do think for employers who needed a little more time, we've considered that.
Yeah, that's right. So this requirement requires the employer to print the information on the employee's pay stub or in some other written form that the employee gets every pay period that says how much sick leave have you accrued and how much sick leave have you used, so that workers are clear on how much they have. And that was something we were seeing in our enforcement, is workers were often confused about how much sick leave they actually had left to use, and no clear way to get that information from the employer. And so this provision would make it sort of clear between employers and employees. Here's how much you have left, and here's how much you've used already. Some employers have told us that they're having some trouble with their payroll company getting that information printed on the pay stub. And so we have extended the time period through November 30th, and we are about to extend it again through the rest of this year. And what we're looking for an employer who needs to take advantage of that extension is efforts to comply. So have you reached out to your payroll company to say, hey, we need to start adding this as a New York City requirement, and has your payroll company said, we need more time, right? So we just want to see that you've tried to implement it. And assuming we see some efforts on that front to attempt to implement it, you will have until the start of the new year where we will not charge any civil penalties for not yet providing employees that written information.
So a lot of our members are very small, mom and pops. Most of them have under 10 employees, probably 80% of our 600 members. And I know that even internally on our staff, my bookkeeper, as soon as she saw it, she did reach out to our payroll department. And, one of the hardest things I think though for her was, especially working with looking at the hours of the part-time employees, trying to calculate kind of what that actual accrual is. Is there any kind of toolkits or information available that can help small employers do that more seamlessly, try to calculate a little bit better, understand it a little bit more, just so that it doesn't become so onerous, like something that maybe, is you put in a certain amount of numbers and it tells you, kind of where things lie?
Yes, I'll start, and then Liz, I'll pass it on to you to talk a little more about the other tools. But we definitely have a template spreadsheet that is available to any business that needs it. We do understand the constraints that many small businesses do not have the ability to hire like a human capital, human resources team, right? And so we have a template that people can use to track the hours of accruals for sick leave on a daily, on a weekly, on a bi-weekly basis. We have instructions for the tools. A lot of our information is translated into as many as 26 languages. If you need help with that, do reach out. But there are a number of other forms that we've also translated. We've also developed and translated. There are forms that can be used under the law to both require employees to verify that they're using the leave for a legal justification under the law. Forms about employers who may require the employees to fill out a form, again, if for any foreseeable need of sick leave. For instance, I am going to schedule surgery, and that I know when to do it. I can give my employer a heads up. Therefore, my employer can say to me, well, for something like that, you should be able to, fill out a form and give it to me ahead of time, right? And there's also an alternative for employees to be able to use make up the missed hours instead of using their sick leave, but that has to be with the consent of the employees and the employer, right? So we have model forms for those types of needs. Liz, anything? Am I forgetting anything here?
No, I don't think you are. I would just sort of emphasize, check out our website and the resources for employers on there, because there is also a great deal of information for employers that employers can use to make sure that they are fully complying with all of the elements of the law. Here we're focused on changes to the law that have recently been implemented, but this is a law that's been in place since 2014. And, we do regularly encounter employers who aren't complying with various elements of it. For example, maybe an employer doesn't have a written safe and sick time policy in their business. That is a requirement and has been a requirement for many years. So anyone who wants to just check and make sure they are doing everything they're supposed to be doing, whether under the amendments or just under the prior version of the law, our website is a great resource to make sure that you've got everything in place.
So any of the new obligations is there anything else that you need to expand upon as far as new obligations for business owners to be thinking about? I do think it's really important too that you mentioned that, this passed in 2014, and, we find at the Chamber, a lot of small businesses don't know what they don't know, and at least if, this might be the first time they're actually paying attention or seeing it. So going back to the website and looking up that, make sure you have those policies in place. Those things are very important because you do inspections as well. So we want to make sure that businesses are being compliant. But are there any other new obligations that we should be thinking about?
So I want to mention two things, not because they're new, but because they're little known. Or one of the updates that happened a couple of years ago is to expand the definition of basic leave to include safe leave too. What does safe leave mean? Safe leave means it covers situations in which an employee who may be a survivor of domestic violence or a victim of sexual assault, of human trafficking, they are able to use the same days, right? This is not additional time. It's the same number of days to be able to take care of their safety, basically. And that includes situations where I may need to make an appointment with a social worker to discuss my situation at home, or I need to go to court to obtain an order of protection against an abuser, right? So again, it doesn't change the number of days, but the law was updated a couple of years ago to say these are valid reasons for taking those sick days. One other thing that I would say, just because it's something that is in the law, but again, people don't really know about it, we didn't use before, is for very extraordinary circumstances. There are a couple of provisions in the statute that say in cases of a state of emergency, right? If the employer has to shut down for reasons, other than their own discretion, the state of emergency is in place, they were ordered to shut down, like it happened in March, right? Employees who had accrued sick days were able to take whatever hours they were left in their bank to get paid for those days as a way of basically saying this was not the fault of the employer, but it wasn't the fault of the employee either. So employees who were sent home in March because of the governor's order to shut down could use those sick days if they had any left, right? It also can be used, by the way, another provision on the law says that if the schools close and a parent needs to stay home to take care of a child, they can use their sick days for that situation. Again, it doesn't give you more time. It's the same 5 days, let's say total 5 days, but it could be used in that circumstance. Anything else, Liz, that you think we need to bring up?
No, I don't think so. I think that those are two big issues that are very current. Mm-hmm.
Commissioner, before you mentioned that there was a form that you could fill that an employer can give to an employee for certain circumstances, that's confidential, of course, to fill out as to why they may need to be off for whatever appointment. But is there any other? Are employers allowed to ask for doctor's notes and things like that, or is it just basically on a form that they submit to the employer?
So employers can only ask for justification if the employee is taking more than 3 consecutive days together, right? So if the employee is taking more than 3 consecutive days, an employer can say, well, I need to see a justification, your note, something that shows that you actually used it for a permitted use. And it doesn't have to be just from the doctor's office. It could be maybe a social worker meeting, whatever it is, right? Now, if the worker has to pay to get this note, this document, workers under the new changes in the law must be reimbursed for that cost. So if it's $10, $5, that's actually a cost that falls on the employer. If there's no cost for the document, obviously there's nothing, right? But yes, employers can ask only if the leave is more than 3 days, consecutive days.
I would just add there, we often do see employers make a mistake on this front and have in their policy that if you use 3 days or more, then you have to submit a doctor's note, which is a violation of the law because it is only on the 4th consecutive day that the employer can require a note, right? So if it's on the 3rd day, they cannot require it, and that would be considered a violation of the law. So employers would want to check their policies and make sure it says after the 3rd day.
Okay, gotcha. So before I kind of mentioned that, especially now with COVID, there are so many things that small businesses are contending with, and they're not only are they having to be compliant with laws like these, but they also have a whole bunch of different whether they have to put up their safety plans and they're getting inspections on whether it's indoor or outdoor dining. How I guess what type of enforcement considerations will your agency allow or be implementing, or what kind of flexibility will these businesses have if you come in and you're speaking to them and basically going out to enforce that they're doing the right thing?
So one of the things we already mentioned, and it's the extension of time to give employers who are trying to make changes in their payroll operations to make sure that employees are given the documentation of their accruals of sick leave. So we certainly, because we've heard from employers who've said, I need more time, and my payroll company actually needs more time to make the changes in my system, we are in the process of extending this to even the end of this year, right? So that is one thing. We need to hear from you guys if there are any significant challenges with any of the pieces of this law. But be be mindful that even if we made an extension, right, the state law is still in place, right? I don't think anyone is rushing out right now to check on the small fixes in the law, because I think the reopening guidelines right now is probably what's at the top of everyone's mind, making sure that we're reopening in a safe manner. But just bear in mind that even if we give an extension, the state law has not given extensions. So we're just trying to do this to accommodate businesses here in New York City. A couple of other things I would say is that we have spent quite a bit of time since June, since the city and the state began reopening. We've visited already over 1,500 small businesses, door to door, over 15 business education days. We've been in Staten Island 3 or 4 times, I believe, just to do business reopening education work. We know that there's a lot of information out there, and obviously, this is an extraordinary situation we're living in, right? So it does require the cooperation of everyone, employers, workers, our agencies, to make sure that your members and other businesses have the right information, the accurate information they need to put in place. And then I would just say also that we certainly are open to thinking about any other types of templates or tools that would make it easier for businesses to comply. We certainly want to have compliance with these laws. That's the purpose of it, right? It's for the benefit to be available to workers. It's not about issuing fines to businesses that don't do it. We'd rather not issue any fines because everyone has this benefit. But I think that the most important thing for us is really to have the compliance, especially, like I said, when paid sick leave has turned out to be a great help in avoiding the rise of infections as a result of COVID-19. There's been, and I don't remember the name of the study right now, but that paid sick leave laws really help with combating this virus. So it's very important that we all make the best effort to just have it in place. And it protects the business owners too, right? If a worker gets infected, like who knows who else will get infected in that particular business. So it's in everyone's self-interest. And then, again, we are here. I know that Alberto's going to put his contact information in the chat. We want to hear from you. We want to work with you and see how we can get you to compliance.
I have one last question, and it's really kind of pertains to the current situation. That we have gotten at the chamber, a lot of inquiries on what if an employee gets sick with COVID? What are my responsibilities as an employer? And I guess, what's been difficult even for me at the chamber is giving the correct advice, because it's really, HR advice that they need. And in some cases, I had somebody who came in and said, I had somebody who traveled, but they traveled at their own discretion, and then they came back, but they had a quarantine for 2 weeks. And, do I have to pay them? Are they entitled to sick time? If we have members that have questions like that, and because it's kind of confusing too, because sometimes I think the employers don't know whether to go to the New York State Department of Labor, your agency, and I really do appreciate the fact that you're trying to streamline things, that both agencies are going by the same guidelines. But is there any support available for businesses that have those types of questions?
Yes, and I'm glad you brought that up, because obviously this is a big important piece of what does an employer do if they find out, right, that someone is infected in the workplace. So there are a lot of reporting requirements, right? And employers do have to report this information to both the State Department of Health and the City Department of Health, who then conduct the contact tracing, right? And so as an employer, you have to be very careful, because you're still subject to all these privacy laws that tell you that you cannot be disclosing the name of the person who's sick to other people in the workplace. You can't do that. You might be able to say, someone has been infected, shown the virus, we're going to close and we're going to clean today and come back tomorrow. but you cannot say, Lorelei Salas brought the virus here. I mean, that's just not legal. Now, I do have to call, again, Department of Health, the city and the state, and tell them that this person, Lorelei Salas, was sick with the virus, who will then call everyone I was in touch with over the last 2 weeks, right? So presumably my coworkers, if I was there at the same time as them, will also hear, but not from the employer. They'll hear from the Department of Health authorities, right? So that's how the employer covers themselves. Very important that, employers are required to do the health intake every day, right? So when I come to work, I have to do either by email or via text or a phone call, I have to report my answers to some questions, right? And the questions are about, having, being in touch with someone who had the virus, displaying symptoms of COVID-19, or having been tested, things like that, that give the employer an assurance that whomever is coming into work is not actually infected, right? Not presenting symptoms. So employers have to do that, and employees have an obligation to respond to that. They cannot say, I don't want to give you this information. And employers can take disciplinary actions in that case if employees do not want to provide the information, right? Because employers have to do it by law or by the state guidelines. So that is another way in which employers really can do their jobs in ensuring that the virus doesn't spread. Now, this issue is important. Employees who are going to be going out of leaving the city, right, traveling to places that may have even higher rates of infection, they need to be able to talk to their employers and explain, this is what I'm doing, and see if employers can accommodate them when they come back to be able to quarantine, right? But it doesn't mean that they can just go and come back and expect to be able, to get paid for that time. Now, I'm not sure, Liz, if there's anything to add there, but I do believe employers can have their own, as long as they apply their policies in a non-discriminatory manner to all employees, you should be fine, right? So if you're saying, okay, everyone is required to do the health intake, and everyone who is even thinking of going away, traveling outside of the city, must let us know and work with your supervisor. And in some cases, because of the nature of your work, you might be able to do the work from home, but in other cases you might not, right?
Right.
So as long as they're not picking and choosing who they enforce it against, they should be okay. Liz, is there anything else to add there?
No, I know the New York, because obviously there's sort of a number of kind of interlocking laws here. There's the New York State quarantine pay, where if you're required to give an order from the Department of Public Health to quarantine, you can get paid for 14 days. We don't enforce that. The state enforces that law. And then there is that exception for if the person has traveled outside of the state. We have not yet encountered a case where a worker was trying to use their paid sick leave for quarantine as a result of having traveled outside of the state. Our law does not contain an exception like the state law does for, well, if you voluntarily traveled outside of the state, then, we don't have an exception like that. So we haven't really looked internally at whether a PSSL should be used in that situation. If an employer wants more information about that, I think we'd have some questions about the specific circumstances of the employee to evaluate whether that was a covered use of paid sick leave. And folks are welcome to call our office to inquire about something like that, a sort of unique situation like that comes up. Yeah.
Okay, great, thank you. I have another question here. Can you please discuss the carryover of employee paid time off? Please confirm employers with less than 100 employees are responsible for paying only up to 40 hours regardless of how much time was carried over.
Liz, do you want to go over this question?
Sure, yeah. So the law provides that employees carry over up to 40 hours of paid sick leave to the next calendar year. well, calendar year. So the employer can sort of define the year for purposes of paid sick leave and carryover. Many employers use a calendar year, but employers can use whatever 12-month time frame they select, as long as it's sort of consistent for all employees. So whatever calendar year the employer uses, the employees have a right to carry over unused sick leave up to 40 hours. The question is correct that an employer with less than 100 employees would only be required to allow employees to carry over no more than 40 hours. Of course, employers are welcome to carry over more than that, but are only required to carry over up to 40 hours of accrued time. And are only required to allow employees to use up to 40 hours, to pay for up to 40 hours each year. So even if an employee has potentially banked more than that, they're only required to pay for 40 hours per year, if it's less than 100 employees. Now, if you have more than 100 employees, that amount has increased. And so starting in 2021, an employer has to allow employees to use up to 56 hours. And right now, employees potentially are accruing that time that would then carry over to 2021 so that they could have up to 56 hours available in 2021 to use. Hopefully that answers the question.
Very good. So I noticed that Alberto is putting all kinds of things in the chat, all kinds of resources and links like that. And you've provided quite a bit of information, all of you today. But are there any other suggestions that you can give us in terms of employers trying to be compliant? Is there a listserv or an email newsletter they can sign up for to make sure they're getting updates? Or, you know, I know that the chamber sends out a lot of information when we receive it. But is there anything else some of these small businesses that are on the line today can be thinking about?
I'll ask see in Alberto if you have any thoughts on that. I know that as we mentioned, we published like a list of FAQs that are on our website, and we updated several different guidelines and guidance documents, especially post COVID-19, since we had a lot of questions about the intersection of the city and the state laws, right? So it can get confusing. So we have that information on our website. Certainly, you know, being able to do these kinds of webinars are really important to us, because this is when we have questions directly from the business community. People can also reach us via, I forget what he called this, live chat, right, Alberto?
Yeah, they can come live chat between 9 and 5. They can speak to one of our employees who can discuss any questions they have. We also have the bi-weekly briefing where we discuss paid and safe and sick leave and other agency updates almost every 2 weeks. Our next one is on the 17th, I believe, of December. So definitely tune in to one of those, and we will send emails out reminding everyone to attend.
There's a couple of questions in here. Do you want to answer them, or do we want to answer them, you know, individually with the participants? I'm just looking at the time, see how much more time we have.
I can't, okay, because I'm doing this on my phone. I can't see the questions in the chat.
Okay.
I can see them. I'm happy to answer them if
Okay.
It's up to you whether you prefer them to be answered live or separately.
They seem pretty basic.
Yeah, okay. Liz,
okay, sure, yeah. So one of them says, so if they're already up to 40 hours and carried over, the accrual basically stops at that point for the next calendar year. Accrual does not stop. So an employer should accrue sick leave for employees at the rate of 1 hour for every 30 hours worked. The employer, though, only has an obligation to pay for 40 hours per year, assuming we're talking about an employer with fewer than 100 employees. And so accrual may continue after 40 hours. The employer does not have to pay for it in that calendar year. It would just carry over. So potentially an employee might be paid for 40 hours in 2019, but then have worked so many hours in 2019 that right at the start of 2020, they have another 40 available for use, because accruals are not capped. Only use is capped, and the obligation to pay is capped. So I think that should address Ms. Capella's questions. Ms. Capella here is asking, are accruals capped or is pay capped? Accrual is not capped, but pay and use are capped. So under 40 hours, or under 100 employees is 40 hours. 100 employees or more is 56 hours. And so you got to carry over. You got to keep accruing all year long and carry over up to that max that may be available for use in the next year.
So basically, it's more of a timing thing. So in other words, you would bring it over just so that they could access it sooner, but they wouldn't be entitled to it. Like, as you know, you kind of almost restart it every year. But
Right.
if somebody didn't exhaust it, and then they didn't, and you wanted to pay them for it earlier on in the year, it would just be a timing, basically.
That's right. That's right. And of course, employers can do whatever they want beyond that, right? So if an employer wants to pay out more, that they're free to do that, right? Our law doesn't sort of cap it in terms of what an employer can do. It's just what an employer must do. The next question says, can you clarify when it's appropriate to request certification for being out? Is it as of day 3, or do they need to request a 4th day before requesting? The answer is they need to request a 4th day before requesting. So if on 3 consecutive days, an employer cannot request documentation of the reason for the use. It is only on the 4th consecutive day that the employer can request documentation for the reason for the use. A couple sort of issues around that. If the employer wants to request documentation of the reason the employee used sick leave, the employer has to have it in their sick time policy that they're going to request that. So the employee knows in advance, I'm going to be asked for documentation. So an employer cannot ask for documentation on the 4th day if they haven't put in their sick time policy, hey, we may ask you for documentation if you use more than 3 consecutive days of sick leave. So it's got to be in your written policy. The employer also cannot ask for details about the reason that the employee used sick leave. So the employee does not have to disclose private, medical information or details about their medical condition in the documentation. It is enough for the medical provider, for example, to say the employee was receiving treatment and is under my care and needed to miss work on these days, right? So that's sort of an employee confidentiality protection there.
Are there templates that you have available for businesses that they could use for language to insert into their employee manuals that could be a little bit more, take into account the actual law, but have the employer kind of insert their own specific language as in terms of like what you were just speaking about?
Mm-hmm. We don't have model language just because that's so unique to an employer and how they want to run their business. What we do have are sort of checklists that say, here are all the mandatory provisions for a sick time policy. Here are all the optional provisions. So an example of an optional provision is if you want an employee to call a certain person if they have an unforeseeable need to use sick leave, like I have a fever, I can't come to work today, right? The employer needs to write into their sick time policy, how to make that report, who to call, call your supervisor, whatever it is. But it's so company specific that we really can't give model language for that because it's going to just depend on how you're running your operation. Yeah.
But there is required language that people can look at and the optional, and when they're thinking about how to actually incorporate it into their employee handbook.
Yeah, there's a summary. We have a regulation on this in the law, and then we have sort of summary documents that sort of break down that regulation and say, if you want to do this, then you need to put it in your sick time policy. So like the doctor's note thing, right, is on that list. If you want to require a doctor's note or documentation of use of safe leave, you got to include that in your sick time policy. So there is on our website a whole list of the policy, a breakdown of the policy requirements.
Very good. So I think that sums up all of our questions. Commissioner Solis, would you like to say any final words before we close?
Just to thank everyone. I know, and I've seen the resilience of our small businesses. They're trying to do the right thing. We've gotten many, many questions from, our many small businesses in New York City who just want to know what their obligations are. They want clear information and clear guidance. So I appreciate that everyone's trying to do this in the midst of also taking care of themselves and their families. So I just want to wish everyone a very safe and healthy end of year, holidays, and I really hope for a much, much later 2021, and really appreciate your partnership here. Please let us know if you want to do this again in a few weeks or early next year. We're happy to work with you.
Thank you, Commissioner. And I agree. I hope we have a lighter 2021 for sure. Thank you, Liz. Thank you, Alberto. And thank you, Jill, for putting this together today. Any of our members, if you have any follow-up questions you'd like to send them, you can send them to Jill, and we can certainly get you answers to any questions. We've recorded today's session, so it will be available on our website for other members to view at their leisure. So, because we feel that this is very important information, and we really appreciate, Commissioner, you and your team taking the time today to bring the information to the chamber and our members. Thank you.
Of course. Have a good one, everyone.
Have a good day, everybody. Thank you so
all.
much. Bye-bye now.
Bye-bye.
Bye.